Hey there, medical student. Welcome back again. Today we're going to be meeting some more of the team in the OR. Specifically, we'll be talking to a couple of anesthesiologists, Neil and Bruce. These are the doctors who are responsible for keeping the patient asleep while we operate. It's also their job to wake them up again. I'm going to ask them some questions, and you can listen in, okay? Okay, let's go. What's your name and your role in the OR?
My name is Dr. Bruce Ramsey. I'm an anesthesiologist here at the Royal Alexandra Hospital.
Neil Clausen, I'm an anesthesiologist.
How long have you worked in surgery?
Well, I finished my training in 2001, so it'll be 12 years now that I've been an anesthesiologist.
I've been here about 18 years now.
What's a typical day for you like?
The average day, if I'm not on call, I'm up around 5:30. I'm in the hospital by 7:15, meet the patient, get the room ready, meet the resident if I have a resident, and get ready for the first case of the day.
There's no typical day in anesthesia. Anything can happen. At the Royal Alex, we do anything and everything in all the rooms. I think we have 5 different areas. Today I'm just seeing patients in consult getting ready for the operating room.
Why did you choose to become an anesthesiologist?
Well, before I went to med school, I had a career in science, and I did some research with the Nova Scotia government, and that was after a PhD and a master's, and I didn't really like that, so I decided to go to med school, but I didn't really know what I wanted, so I went through every rotation trying to figure it out, and anesthesia grabbed me pretty much the first time I spent a week in the OR.
Tough question. Tough question. I actually went back to med school to become an emergency doc. I'd been working ambulance for 9 years. And I kept working through med school, and I was just tired of that style. And first morning I did anesthesia, I just knew that's what I wanted to do.
What's your role during an operation?
Well, normally see the patient in advance, make sure that we have all the information and they're aware of what's going to happen, formulate a plan with that patient, and then we go into the operating room. They get hooked up to some monitors. If they have not already got an intravenous, we put one in, and then we drift them off to sleep, or in some cases we will do a spinal anesthetic with or without some sedation. And then we proceed to have surgery and monitor them throughout the course of the surgery. So the surgeon can concentrate on surgery because we're looking after the physiology of the patient.
What makes an effective OR team?
Leadership is part of it. Not a forceful leadership, but a leadership where there's confidence and everybody's comfortable in the roles. Communication is part of that as well, I'd say.
What's the best thing about being an anesthesiologist?
I like the variety of my work. I might be working with ophthalmologists one day, I might be doing labor and delivery the next day, I might be doing total hips and total joints the next day, and the day after that I might be in pre-admission clinic.
What's something most people don't know about the OR?
I think most people don't know about the smell. That shocked me the first time I went to the OR, how much smell there is there. And by smell I mean the smell of body parts, the smell of surgery, the smell of cautery, those kinds of things.
I think most people have the knowledge they have is from TV, which is a very completely different idea of what the OR is supposed to be. So I think most people, it's not a lack of knowledge, it's a complete misinformation. So I've had a young guy came in one night for an appendectomy, and he was panicking by the time he got into the operating room because everybody wasn't running around like they did on whatever the show was that he liked to watch. So, if people are running around, then you can worry, because then something's wrong. But otherwise, everything should be in a nice, predictable fashion.
Do you have any tips for med students new to the operating room?
Don't be afraid to say who you are to everybody. Identify yourself by name and say hello to everybody, the patient, the nurses, anybody walking in the room, and especially the anesthesiologists. We're usually more than willing to say hello and show you around a little bit.
Never cross a scrub nurse. My wife's a scrub nurse. Never, the OR nurses, the one that scrubbed is responsible for the sterility, which is ultimately the safety of the patient. And they really take the sterility very seriously. So when you learn how to scrub and come in without dropping your arms and all the proper things, that's what you have to remember, because sterility is utmost in the OR.
Okay, so now you know a little bit more about the role of the anesthesiologist in the OR. It's a pretty exciting job, almost as exciting as surgery.